The 13-month-long, all-encompassing siege has brought a terrible impact on many patients with chronic illnesses, particularly HIV, as they couldn't get medications they need to survive. African Service Committee in Maqala is the only center in Tigray which gives drug assistance for HIV patients. The health practitioners at this minor center said that it's been long since they've run out of medical supplies and that the ongoing siege has made it impossible for them to give proper service, which has led to the subterfuge expansion of the disease.
HIV disease is expanding tremendously.
The practitioners explained that among 418 patients, around 17% of them welfare is unknown, while the rest are exposed to opportunistic infections due to extreme lack of essential supplies.
Among our 418 patients, 69 patients' whereabouts is unknown, as there is no telecommunication, while the rest have stopped taking medicine.
The unavailability of anti-HIV drugs and vital HIV testing instruments has forced the professionals to diagnose them only by seeing the signs.
There is a problem on medical supplies. Devices like CD4 counts and viral loads, which are used to identify whether the medicine is accustomed or not, are inaccessible. This has driven us backwards. Before, we were confirming by using these equipments, but now we are deciding the stage of infection only by seeing the visual symptoms.
According to the health workers, the deliberate blockade of food and medicine by the federal government is an indication of brutal intention towards the people of Tigray.
As Tigrayans, we are denied our right to live. It's like a death sentence.
The health workers added that the siege has psychologically traumatized them as they can't offer medical assistance but to see their patients die.
It is really demoralizing, especially to say there is no medicine to breastfeeding mother. It breaks our hearts to say that the virus is being transmitted to her baby.
The health workers call upon the world to do everything within their power to make drugs accessible to thousands of desperate patients whose lives depend on medication.
Special attention should be given to this epidemic. NGOs, diaspora, media, the international community should double their effort than before.
Unless the international community seeks to help those patients, it is unavoidable that the death toll of the HIV patients will rise alarmingly. Several pregnant women in Tigray are dying as there is no ambulance to give service. The ongoing humanitarian crisis in Tigray has been exacerbated by the deliberate and systematic destruction of medical facilities by Ethiopian forces and their allies from Eritrea. Mr. Mu'uz Kahsai is a father of 7 who lives in Maqala, Aidar district. He has lost his wife after she gave birth as there is no ambulance to help on time.
Since there is no telecommunication to call an ambulance, I went out to search for a vehicle, but there was no ambulance to be found. She was grimacing in labor pain and finally gave birth to a baby. But when I came back, my wife had passed away.
In addition to the 20 days old infant, the ongoing siege that has blocked essential life-saving supplies such as food and medicine has made it unimaginably difficult to raise his 6 children.
Till now, there is no aid given to me. I am feeding my baby by buying milk. Because of Abi, we are living in a vile siege. I can't explain how heartbreaking it is to see children dying out of hunger. I call the world to see our adversity.
Dr. Binyam Tawalde, an obstetrician and pediatrician at Lakatit Israel Sedestay Hospital, said the demise of mothers is increasing sharply as there is no telecommunication and ambulance service.
Mothers are not able to come to hospital as there is no ambulance service, which has stopped due to the blockade that has hindered fuel to access. Hence, many mothers are forced to give birth at home.
Just like Mr. Mu'uz, the people of Tigray are still suffering from the ongoing deadly siege that cuts people off from all public services such as banks, telecommunication, electricity, transportation, and the like.